Thank you, Wojciech. So I would like to say a few words about our operational clinical cardiovascular research center. And it was founded by Dr. Arthur Moss more than 40 years ago. His legacy and his contribution to clinical science, we're going to talk about it a little more. Wojciech is going to talk about it in the next talk. But he founded it, he affected all of us, and this is the reason we're all here. The main aims of our research center is to advance arrhythmia and sudden cardiac death research, to allow early identification of high-risk individual. We want to prevent sudden cardiac death, and we want to identify modalities for better treatment and to improve outcomes in the risk of sudden cardiac death. And for this is the Arrhythmia Center. And personally, I came here in 2004 because I heard about this center. I came here just for training, and I stayed here on and off. I came from Israel, then I went back and came back again because this is the leading center in arrhythmia research, especially inherited arrhythmias and device therapy for the prevention of sudden cardiac death. So we're leading research in device therapy for sudden cardiac death, drug therapy for sudden cardiac death, and of course inherited arrhythmia, and this wouldn't be possible because of the people here, without the contribution of the people here in the room. And in each area, our research has led to change in clinical practice and even guidelines recommendation of the American College of Cardiology, American Heart Association, and Heart Rhythm Society. And if you want to present our research center, we have a very big infrastructure, close to 40 patients, including programmers. When the data from you stream in, we have to program, we have to include this in a huge database. We have statisticians that really look at the effect of all the therapies, the genotype, the change in medical therapy over a lifetime. So there has to be time-dependent analysis. We have created databases. We have an advanced technology and database center, and we have big data and AI looking at all those modalities. And we are, of course, leading international clinical trials for device and medical therapy for the prevention of sudden cardiac death. And we're also working closely with the university in initiating clinical trials to advance this therapy for the prevention of sudden cardiac death. And we also want to train the next generation to do the same thing, to advance clinical research. So this is a big operation that we have you to thank for. And for this, we have a lot of experience beyond long QT syndrome, working with the NIH, federal and government, and also industry supporting clinical trials, again, focusing on the risk of sudden cardiac death and therapies to prevent it. You see, this is a huge amount of clinical trials that we've been running over the past 30 years. And one of our focuses is on device therapy for the prevention of sudden cardiac death. And this is the series of MEDI trials. I know that some of you have implantable defibrillators who are high risk for sudden cardiac death or have already had syncope or an arrhythmia. And this series of clinical trials attempted to identify high-risk patients in advance before developing an arrhythmia, before developing syncope, before developing an horrific event, to identify those patients who are at high risk in advance and to implant a defibrillator as a preventive therapy rather than after an event. And we have shown in this series of medical trials that we can result in 40% reduction in the risk of sudden cardiac death using this mode of therapy. We also have a series of NIH-supported trials, and beyond long QT, Wojciech has also been leading another inherited arrhythmia registry looking at ARVC, arrhythmogenic right ventricular dysplasia. It's also an inherited disease, which in contrast to long QT, we know less about it. There's less preventive therapies like beta blockers. There's less risk stratification in this population, and want to lead research in this inherited arrhythmia as well. And this is the scientific output that came out of this registry. It's a huge amount of output, a huge amount of change in clinical practice and guidelines. And again, we have to thank you for this. And this is, again, one of the reasons I came here in 2004 and stayed here for up until now, I guess, on and off. Thank you. And Wojciech.